Everything you wanted to know about Plan N, the Medicare supplement, and how it works, and questions that you may have had that we have found the answers to. Hi, my name is Christopher Westfall. I help seniors across the country with their Medicare insurance. And today I want to delve a little deeper into the inner workings of Plan N. We've probably got 1,000, maybe 2,000 by now clients just with Plan N, and each one of them have experienced significant rate decrease from where they were before, and they're happy with the way that it's worked out for them. And I want to go into the questions that people have asked that are addressed in this document right here. This was an NAIC, which is the National Association of Insurance Commissioners, who get together and they put together the template for which the Medicare supplements are ultimately adopted by the various states and by CMS. And based on NAIC Model Regulation 651, as it was published in the Federal Register on April 24, 2009, in preparation for the modernization of Medicare supplement plans, which happened in 2010, this document came out. And in this document, it seeks to address how Plan N, which was new at the time, was going to work. So let's dive into a couple of things here. First of all, it said it shall include only the following. The basic core benefits is designed in whatever. It's talking about 100% of the Part A deductible. So when you go into the hospital and you have Medicare Supplement Plan N, it pays 100% of the deductible there. Also, skilled nursing facility care and medically necessary emergency care in a foreign country, it is as defined in the section that allows that to happen. That's talking about the deductible and all that stuff on the out-of-country benefit that is unique to certain Medicare supplements. So, the co-payments, it is A, the lesser of $20 or the Medicare Part B coinsurance or co-payment for each covered healthcare provider office visit, including visits to medical specialists, and the lesser of $50 or the Medicare Part B coinsurance or co-payment for each covered emergency room visit. However, this copayment shall be waived if the insured is admitted to any hospital and the emergency visit is subsequently covered as a Medicare Part A expense. So what does it mean there? They're talking about a copayment when you go to the doctor, and we're going to go in depth into what is charged on that and what should not be charged as far as the CPT codes, which doctors, which treatments are you going to, when they're going to charge the copayment or when they're not, and the $50 going into the emergency room. That's waived if you go into a full admission into the hospital. That's covered under Part A. We already talked about Part A is covered at 100%. So in order to ensure consistent implementation of this new standardized benefit Plan N, CMS and the Seniors Issues Task Force of the NAIC have developed the following guidelines. Here's the question. So this is in reference to CPT codes. Those are the codes that doctors put on their claim forms to get reimbursed by Medicare for things. Those are diagnostic codes and everything that they're billing for. So the deductible, that is the Part B of Medicare deductible. People often get this confused thinking that the deductible is with the insurance company. It's not. It's with Medicare itself. So if you're with an insurance plan like a Medicare Supplement Plan G or Plan N that have as a component to it the fact that you're going to pay the Part B deductible, then if you've already paid that deductible with one insurance company as your insurance company, and you change Medicare supplement insurance companies throughout the year, you can do that anytime you want, any time of the year, as long as your health will allow it, or if you're in Missouri, if it's your anniversary rule, or if you're in California or Oregon, your birthday rule, or Washington State, New York, Connecticut, Vermont, you can change anytime you want to. I digress. If you're changing your Medicare supplement, your deductible already remains paid because it's paid, again, at Medicare up in Washington. So it does not matter when or if you change your Medicare supplement, it's not going to affect your deductible. Once it's paid, it's paid, it's paid. And you're not going to meet it again with a different company. So the deductible will payment for the Medicare Part B deductible by the beneficiary when the beneficiary has a Plan N policy operate the same way as fee-for-service Medicare, in that the beneficiary will pay a coinsurance or a copayment for the Medicare approved amount of services only after meeting the deductible? And the answer is yes. Plan N subscriber is responsible for meeting the deductible. Now in 2018, that was $183. 2019, that was $185. 2020, it's anticipated as of the date of this recording, it's going to be $197. That may change. We usually find out around middle of November each year what it's going to be for the next year. So once the deductible is met in full, Let's say in 2020 it's $197. Once that's full, then the subscriber is responsible for up to $20 office visits and up to $50 emergency room visit. So first you meet the deductible. You don't do the deductible and co-payments. You would just meet the deductible first. Under Plan N, what constitutes an office visit? This is good. For the purposes of determining whether a subscriber is subject to the Part B coinsurance or co-payment up to $20. So services coded as office visits or evaluation and management visits. So services coded as an office visit or evaluation and management visits and billed under Part B office claim forms would be considered an office visit for determining whether or not the subscriber is subject to the Plan N Part B coinsurance up to $20. It lists the range of CPT codes there. It lists an eye exam with an ophthalmologist for disease treatment of the eye, psychotherapy. When applying the Plan N physician office copayment, should the amount be applied only to the office visit charge and not to other charges such as labs, x-rays, medical equipment? Yes, that's right. The coinsurance or copayment should only be applied to the office visit codes, not for labs, not for x-rays, not for DME. Very important to know that. If the Plan N subscriber presents for multiple covered office visits in one day, is the coinsurance applicable to each visit? Yes. If you go to a primary care doctor in the morning, he refers you to a specialist. You go to a specialist in the afternoon, she charges an office visit as well. That could be up to $20 for her as well. There are no office visit codes used solely for visits to specialists with the exception of the ophthalmology and psychotherapy codes listed above. So, which apply to non-specialty office visits. Also apply the Plan N specialty office visit coinsurance and copayment. So what does that mean? It means that there are co-payments expected at both primary care and specialty office visits. Just count on it. Would online, telephone, or telehealth services, which are all the rage for 2020, constitute an office visit for purposes of determining whether they are subject to the Part B coinsurance copayment up to $20? Providers do not code these services as office visits, office consultations, or evaluation and management visits. Therefore, they are not subject to the Plan N coinsurance or copayment. So if you find a doctor that is doing the telehealth service, I just read in the news that Jeb Bush and who's the other famous actor, the famous singer, tap dancer, it'll come to me. They're big sponsors, backers of a new telehealth and home visiting doctor service that is going to work with some Medicare plans. Number 7, does the Plan N office visit or emergency room copay apply to the foreign travel emergency benefit? No, that's completely separate. Talk about the ER. Emergency room coinsurance and copayment. Does the Plan N emergency room coinsurance or copayment apply to the physician professional fee charges that the ER facility fees or both the ER and the physician's office send? You know how you go to the emergency room and you'll get one bill from the facility and one bill from the outpatient or for the outside doctors that come in to treat you? It says the Plan N ER coinsurance copayment applies to the total Part B coinsurance copayment patient responsibility as shown in the remittance advice. That's the bill. The total. The physician professional fee portion of the charges for the ER visit are identified with a different CPT code. So that means you pay one copayment in the ER up to $50, and it doesn't matter if you get a bill from the doctor and the hospital. You're only going to pay that one $50, not twice. Number 9, is a Plan N subscriber subject to both the Plan N physician professional fee charge up to $20 and the emergency room facility coinsurance up to $50 as a result of a covered emergency room visit that does not result in a hospital fee? Again, no. Only one up to $50. Is it waived if a Plan N subscriber is admitted to the hospital and the care is paid under Part A? Then the Plan N ER coinsurance must be waived. So if you're admitted into the hospital, and remember the difference there, we've covered this in past videos of the difference between under observation or fully admitted to the hospital. This has been a debate going on for over 10 years. The hospitals don't want it to look like you were admitted, then discharged, and then possibly readmitted if they didn't fix you what was broken the first time. So they will sometimes put you under observation, watch you even for a few days, not fully admitted, so that it doesn't look like a readmittance if you come back in and actually get admitted later. So when they do that kind of a scheme, it's all under Part B. So if you did not have a Medicare supplement at all, that entire bill for up to like 3 days in the hospital, the real hospital, if it's charged as an outpatient thing, they can still consider it under observation, not under Part A of Medicare, where you would simply have that one deductible. No, it's all billed under Part B when you're under observation. In that case, you would be responsible, absent a Medicare supplement like Plan N, for paying 20% of the entire stinking bill. And that can be huge. I've just heard a story today that it was huge. The lady sliced her hand really bad with a weed whacker. Then it got infected, went into the hospital. Oh, it was a big, big bill. All of it under Part B at an unlimited 20% coinsurance with just original Medicare if you don't have a Medicare supplement. We got her hooked up today, though. Number 11. If the Plan N subscriber presents for multiple Medicare-covered ER visits in one day. Can you imagine going to the ER and then saying, forget about you. I leave. I come back. I leave. I come back. Yes, it's applicable to each one of those. So just stick around until they can get to you. Is the Plan N ER office visit coinsurance or copayment applicable to urgent care? This is cool. And this is what we tell all of our clients that are getting on Plan N. You go to an urgent care, which my family tends to get sick. My wife with the flu recently, my daughter right before that with it. We go to the urgent care because it typically presents on a Saturday or Sunday, and getting into the doctor's office for a routine thing is just not going to happen to a primary care. So we go to the urgent care quite frequently. Since a visit to urgent care is not coded as either an office visit or an ER visit, it has a unique code. The Plan N copayment for either office visit or ER then does not apply to an urgent care facility. We're talking about, again, those doc-in-a-box things that they have like at CVS and all that. If they accept original Medicare, you're good to go because your supplement's going to pick up the rest. Under Plan N, why is there a greater coinsurance or copayment for emergency room visits than for office visit? The intent of having a greater copayment for emergency room is to encourage office visits where they are appropriate and discourage unnecessary emergency room visits. Had a lady comment on one of my posts the other day on a video, and she said, forget all this nonsense of trying to get a physical exam, an annual exam. Just go into the emergency room and tell them you want an x-ray, an MRI, tell them all this stuff. Go ahead, Medicaid will cover it, she says. Medicaid. See, there's a difference between Medicaid, which is the low-income state-run program, and Medicare, which is what all my videos are talking about. I'm sure Medicaid would probably cover that, but Medicare is not even going to cover it if it's not medically necessary. You can't just go willy-nilly doing all kinds of strange things and just jumping into an ER just because you want to. It's just really not going to work like that. So I wanted to go over one more thing, and that's just to look at all of the plans that Medicare has for the Medicare supplement. And I'm going to pull them up here and drag them right over. And here they are. So this is a list of available, as of 2020, Medicare supplement plans. And I'll tell you what's really going on in the market. A lot of people, if they're left to their own devices, will come up with something like a Plan K or a Plan L. They're like, it's good enough. I just went directly to AARP or whoever, bought my own plan. It looked like it's good enough. Well, if you look at the diversification of plans within an insurance carrier, and we try to look really deep when we're picking up a new insurance company, whether it's a Mutual, a Cigna, Aetna, GPM, Bankers, Anthem, all of them. We want to see what their mix of business is. And we will see like a couple of hundred people across the country maybe are on these plans, and they're sold so infrequently that the company people are like, okay, what? Do you know really what you're doing? Sign up for like a Plan A, which really doesn't cover much. And then you've got Plan C, which was pretty popular back with Plan F, not available, either C or F, to new people, new to Medicare as of January 1, 2020. But if you had those plans, you could certainly keep it. I don't know anybody in the last 25 years that have signed up for Plan B or M, as a matter of fact, or K and L. The K and L people are typically people who got a direct mail flyer from a big company with letters for the name, and they just signed up for it themselves. No, the majority of people over time have signed up for Plan F, which has been great for my business over the last, 11 years focus on moving people from Plan F to Plan G. I have a website called plangisbetter.com, and it took off really, really well. talking about the aspects of, as a matter of fact, that video had something like 300,000 views on it. Plan F versus Plan G, which one's better? It's been copied many times from other agents. But that was a big focus, moving people away from the all-in-one inclusive Plan F, which was just ripping them off like crazy. For the only difference of what is the deductible or not, they're paying like 3, 5, 10 times the deductible cost. And that's the only difference from Plan F to Plan G. Plan G, you pay the Part B of Medicare deductible. So let's say $197, you pay that. But to have that paid for you on Plan F is the only difference of Plan F. You just have the plan pay for everything for you. So the difference from Plan F to Plan G should be exactly the Part B deductible, right? Because that's the only difference. No, it's often $300, $400, $500 more per year for the Plan F. So it never made sense from the beginning. We've tracked over a trend of 18 months just recently all of the rate increases from all the carriers on Plan F, Plan G, and Plan N, which led me to create the other website, which is PlanNMedicare.org. And that shows the advantages of having Plan N, PlanNMedicare.org. Check that out. So we're seeing a shift now. It's kind of funny. In the last couple of years, the majority of the agent population has now been, since 2015, since MACRA was passed, finally adopting going to Plan G as a primary. If you look back over the archives of the internet, even the YouTube videos, you'll see that as of 2015, everybody was signed up for, Plan G is all the way to go. We've been saying that since 2010. When Plan G and Plan F, there was a difference on excess charges. Plan G before 2010 only paid 80% of excess charges, made it kind of confusing. With this Medicare modernization that this Plan N was a part of, they made Plan G exactly the same as Plan F. 100% paid on excess charges, foreign travel, all the rest. So everything is exactly the same on F and G. Well, we were doing this back in 2010 when they made that change. Everybody else kind of came to the party late. 2 years ago, we had an all-out focus on Plan N when it makes sense for people, especially looking at the trend line that we published, I think it was 18 months ago, all of the markers for the rate increases. Plan F just has gone crazy, just nuts. Plan G, within the last 18 months in anticipation coming up to the end of 2019, in anticipation for MACRA starting January 1, 2020, when Plan G now has to become the de facto guarantee issue acceptor for people who are in a special election period. That is, those people new to Medicare that will be losing employer coverage, they can get Plan G guarantee issue. That job used to fall on Plan F, not anymore. As of January 1, 2020, those people new to Medicare after January 1, 2020, Plan G will have to absorb those people as guarantee issue. What does that do to the trend of the rates? It goes way high. Up to this point, Plan G never had that moniker of having to accept guarantee issue people. That fell on Plan F. My theory is that the lobbyists with the insurance companies said, well, Washington, if we have to accept somebody on a plan, let's make it Plan F because we make the most profit on that plan. And up to this point, that's exactly what it's been. But since you can't buy Plan F anymore, if you're brand new to Medicare after January 1, 2020, then Plan G becomes the de facto standard for all guarantee issue business for those people going forward. So we've already seen in anticipation of MACRA implementation G going very high with rate increases. For those that will, for those that are willing, and in the communications we give to our people when they're facing their renewal time with their Medicare supplement, and that is Medicare supplements automatically renew. They're guaranteed renewable. There's nothing you ever have to do about it. But when we come up to the renewal time, about 45 days prior, we and our clients will get a notification that here's the prospective rate, what it's going to be if you stay and don't do anything with your plan. So when there's a differential there, we definitely want to shop those plans. We send out an email, we send a voicemail to our people. We try to reach our clients and say, look, if you're on this plan, let's take a look at this plan, and here's why. That's what we do for our clients and have for the last 10 years. So Plan N has taken a large majority of our people that have been renewing over the last 18 months. Some people just want to stay with Plan G, and that's fine. Some of the people that we inherited and insisted on Plan F just want to stay on Plan F, and that's fine too. We want to listen, but we want to be respectful of the fact that we just want to give the information first and then let our clients make that decision. Incidentally, it kind of made me laugh today. I had an email from someone who emailed me for help the other day, and asked me for rates and a recommendation based on their situation and all that. And because our phones are just absolutely blowing up, and we had a couple of people today just really, really nasty and no patience left, but we have to remember the hundreds of people that we have been able to help already during this AEP. And for some sudden reason, 60 million people think that they have to make their choice, their change, if they're going to do one. In Medicare supplement, people don't even have to do a change at all within the first 10 days of the AEP, or else they're going to be really, really mad. And we've not been able to be all things to all people. I'll tell you right now, we have failed. I could have had 100 agents in here and not been able to answer as many phone calls as have been coming in. So had a couple people mad about it. But this gentleman, to start the story, sent me a request for information on rates. And I looked up the rates for both for Plan G and the rates for Plan N. I made a recommendation based on what he was looking for. And this was all by email while the phone's ringing and we're multitasking. And I'm chatting with somebody on the website at the same exact time. And that was last week. He wrote to me today and said, hey, I called Aetna and signed up for that plan that you recommended with them, and I got approved through underwriting. So am I going to have to do this with them every single year, or how does that work? So the bottom line is he took our information, which I'm happy to provide and help anybody with, and he went and signed up directly to the insurance company, and he still wants the services of an agent, somebody to be accountable to him, answer his questions, walk him through the rest of his life on Medicare, but did not think to make me the agent so that I could actually benefit as part of that relationship. And sometimes the fact that that's lost on people just kind of bewilders me. But here's how that works. People often ask, how do you make out? How do you make money on this? About 20%, according to, the medical loss ratio rules that were inherent with the Obamacare legislation, no more than 20 or 25% of the entire premium can be for all administrative stuff, right? Well, on the Medicare supplement side, about 20% of the premium is allocated toward commission. Now, if you go direct to the insurance company, you pay the same rate. They're not allowed to have a different rate for you because you went direct and a different rate for my client because they went through me. It's the same standardized rate. Same rate if you went through me, same rate as you went direct to the company. The difference is the company keeps that extra 20% if you go direct to the company. And you don't have an agent that's going to help you if you had a claims question or problem, a billing question or problem, or a customer service question or issue. You don't have anybody that's accountable to you. So my question is, if the 20% is already built into the rate, there's nothing you can do about it. You can't bypass it and offer to the insurance company, hey, I'll pay you 80 cents on the dollar if I can just deal directly with you and I'll cut out those nasty agents. It doesn't matter. It's filed with the insurance department. That is the way it is. It's already built in there. So my point is, you might as well use the services of an agent who provides value to you, to the community, to the city, whatever, makes a recommendation specifically for you if we can do so, and be your agent and do that. It's just only kind of the right thing to do. It's like, going to a mechanic and saying, hey, please diagnose my car, and spend 3 hours doing it. I'm not going to pay you. I'm actually going to give the work to the guy at the shop next door that did absolutely nothing for it. But I want all your recommendations. Now I'm going to take your recommendations, go to the shop next door and say, hey, here's what the expert said to do. Can you just implement this plan from the expert? And that's the kind of, sensitivity to doing business and just doing it in a moral and ethical way. I think you should, do business with the people who bring you value. It's just my personal opinion. I try to. I'm the craziest tipper of anybody that I've ever seen when I go out. Have you ever been to a restaurant and you get that amazing service and then they remember you when you come back? That blows my mind. We're like that with our clients here. That's why we have all 5-star reviews, because our clients that we are able to spend the time with. And again, if you've been trying to call our office and we have the list prioritized of who has to do something right now, because your Part B effective date dictates that you have to do something right now. Those are number one. Then the people who are underwritten, and the people who are Medicare Advantage, because we've got longer time to work down that list. All three are going at the same time, and we're doing the best job we can. Lady, so irritated, left a message and said, I'm beginning to have thoughts about you because you're not answering the phone every time I call. Well, here's the thought. If you think that we're a scam operation, if you think that we're not legit, absent the fact that you can verify everything that I've said with the Department of Insurance, with CMS, with Medicare, that we're a really legitimate organization, forget all that. But if we were a scam organization, wouldn't you think I'd have 100 butts in the seats to gather all your Medicare information and go out there and run a scam? I mean, that would make more sense if we were just too eager to jump on the phone. We had one person today. I mean, we're literally answering the phone as fast as we can and helping as many people as we can while still being sensitive to spend enough time listening and paying particular attention to your specific case. Eugene had a call today with a gentleman who wanted to say, well, why do I need to go with you? Why don't you convince me to shop with you? And it's like, seriously, we don't have time. Here are the facts. Here is the best plan. Here is the best rate in your area. We can help you with it or we can't. But and this is all he was trying to say, Eugene, was, I just can't call you back 15 times and see where you are in the decision-making process because literally the phone is ringing every second. We want to help everybody we can with a good recommendation, with signing them up, with following up with the Part D plan, with showing the myriad of other things that you may want to complement your Medicare coverage with. And then we have an admin team that follows up, lets you know when it was approved, make sure you got the temporary ID card, follows up, make sure you got your policy in the mail, all the things that are necessary to do, but that stuff takes time. And so we're not a sales organization who are going to put on a high pressure pitch. And if you're thinking about calling my office or you're on our list and we're going to call you back, please don't expect a sales pitch because it's not going to come from us. We'll explain the parts to Medicare. We'll guide you to some resources that I believe will help you. They have helped thousands of people prior to you calling us. And then we'll take care of you on a one-on-one basis so we can do the best job for you so that you will. Lady today had 10 brothers and sisters, and she said 3 of them have already become our clients because she found the videos. That makes me so happy on the inside. And so we just have to, I'm talking to myself and my team here, we have to remember the people who we've been able to help. And we have to quickly, as fast as we can, in order to keep our sanity in this crazy time of the year, put out of our mind the people who are angry, calling 4 and 5 times within 10 minutes, wondering why they have to make an appointment to do an application because everyone's schedule is literally full. A gentleman yelled at me today and told me some obscenity to do with myself because he had to make an appointment, or actually it was my wife who is sick as a dog but is working in here trying to call people back to verify their appointments because we don't want people to miss their opportunity to be on the phone with our team. She was calling merely to verify this guy's appointment, 11 o'clock, and he was so nasty to her. I'm going to ask my attorney tomorrow if I can play that video, that audio from it. He was just so nasty to her. I literally sent him an email and said, sir, I'm sorry, but as a client, you're fired because you don't talk to my staff, especially my wife and that staff, the whole staff, in such a nasty way when all she was doing was simply trying to confirm an appointment. And his argument to her was, I saw an agent out in the public, and this was probably sitting in a Walmart, or sitting in a CVS pharmacy or sitting in somewhere, an agent just sitting there with a clipboard with nothing else better to do. And he said, this agent said that their schedule's wide open today and tomorrow. I could sit down with them anytime. And my wife just simply said, sir, are you asking me to cancel the appointment? Because she's ready for you. I just needed to verify that you're going to be there. And he was so angry with that. And we don't want to deal with angry, nasty people. If they don't have patience, just please don't call. Please take this as a disinvitation to not call. We don't want to deal with people who are angry, expect to be sold, expect a dog and pony show, and expect pressure. We're here to educate and serve our population. And so to the extent that we do that, we do the best job we can, but we're human. We're a small team dealing with over 100 incoming calls per hour right now. And yes, it will taper off. And yes, even for the Medicare Advantage folks, we have until March to get off the Medicare Advantage plans. Our first target date is January 1. We're working toward that, but we have until December 7th to pull that ejection seat on that Medicare Advantage plan. And so I'm just asking for patience. If you're working with my office, just please be patient. And if you can, just try to be nice to our people, because I guarantee you they're working long hours. They're coming in early. They're staying late. They're working Saturdays. Everything we can do to get this to a manageable level so we can help all the people who've asked for help. And when we get to middle of November, it will be calm again, because the storm always happens this way, and the expectations I cannot set straight enough that everybody thinks they have to do it within the first 10 or 15 days of the annual election period, and that's not true, especially if you're our existing client and your renewal dates like March, April, June, July. This period of time has no bearing whatsoever on the Medicare supplement that you possess. We want to talk to all of our clients within 45 to 30 days of their renewal date just to shop the market, but it's going to guarantee renew anyway. It's going to be okay with those plans. We don't have to have a panic simply because of what we're seeing on TV. We need to be rock stable with the Medicare supplement, at least, knowing that thing's not going anywhere. It's going to be okay. So if you have a Medicare supplement, it breaks my heart every time we have these engagements where we'll have somebody that's on a Medicare supplement and we can't move them because of a health condition. And knowing all the health, parameters for all the different companies that are out there being independent, I know that if someone presents with a chronic case of diabetes that's uncontrolled, or COPD and using multiple inhalers, for instance, those kind of things that just lend themselves, like congestive heart failure, there's just nothing in the market that's available on the Medicare supplement side, and we have to let them know that in a very sensitive way. And if they're on a Medicare supplement, though, the good news is you've got coverage that can never be taken away from you. That's guaranteed renewable. It will be there, and it's the best kind of insurance you could possibly have. So we can rest easy knowing that you did make a good decision when you got on a supplement plan, because unlike some other plans out in the market, it cannot vacillate to and fro and change benefits and change networks and change requirements and change pre-authorization rules. Medicare supplement's never going to do that for you. Melanie just took a call from somebody with a Plan J from probably 2006. A Plan J. They haven't sold that in a long, long time, but it just goes to show that even if someone bought a plan that is now obsolete, can't sell it anymore at all, it's still rock solid. It's still just ironclad as it was the day she signed up for it. Same thing will happen to Plan F and Plan C. When no one new into the market can buy that plan, 20 years from now, we'll look back and have someone still on a Plan F and a Plan C. I wouldn't recommend it based on the numbers, the economics of it, if they can switch. But if they can't, it's okay. It's still going to be good, rock-solid coverage with the freedom and flexibility to go to any provider in America that accepts original Medicare. So that's just a personal word from me to you as to where we are in this season. As I record this, it's October the 29th. My entire team is exhausted. We're doing the best we can, including my entire family who's making sacrifices so that we can be here to help our clients who expect our help. We're working around the clock, trust me. And when I'm making these videos is the time when it's already dark outside. I'll share it with you. It's already dark and nasty out there. Everyone else is in the 5 o'clock traffic. I'm here making a video so we can talk about things like Plan N and what's new in the Medicare world. Because I firmly believe that a lot of people, well, now over 2.5 million views on the channel, are relying on sources of news and updates for Medicare, and that's what I'm going to be providing you. Tomorrow morning I have a news interview with a local, I think it's CBS news affiliate to talk about some things going on with Medicare, and I'll be sure to bring that to you as you're a subscriber to this channel. If you're not yet a subscriber to the channel, please subscribe so you can get some timely information on what's happening, the proposed changes, because there are 3 different bills right now pending in Congress, 2 on the House side, 1 on the Senate side, to address Medicare. How are those things going to play out? Stay tuned to this channel and you will see. I'm Chris Westfall. Thanks so much for watching. Thanks for your patience as we get through this season. And anything I can do for you, please reach out. We've got chat on our website. We've got an email submission form on our website. And we've got the 800 number that's coming in that's being screened right now through voicemail because all of our people are calling people back on the front end. So again, please have patience and thank you for doing so. God bless you. Take care. Bye-bye.
On ABC News 4, a server at Coconut Joe's says an unexpected act of kindness touched her life and her heart. In a post on Facebook, Christopher Westfall detailed how he overheard a man threatening to dock a server's tip, all because she didn't root for the right football team. He said his wife stepped in and he decided to tip that woman $200. Today, we talked with the server about the impact of that action.
I mean, 10% to a server when we're doing our most is kind of hurtful, so that the tip that Chris left me was just, and this time of year, it's very hard to survive on our income.
Westfall says he and his wife were just in the right place at the right time, and they are thrilled they were able to help Maria out.
Hey, thank you for dealing with mean people.
The nice, good people outweigh the mean people anyway, so.
They do.
To give you a call, either